Okay, hello everyone. So we just celebrated our 5-year anniversary at InTouch Primary Care, and it's really been a joy to walk alongside so many of you on your health journeys. And over the next few weeks, I want to share more about our practice and the model we offer. And I'm going to do that by answering some questions, some common questions that people ask me about our membership-based care. And today we're going to cover 5 of them. Okay, so what inspired me? Okay, so I wanted to practice medicine in a way that it was meant to be practiced in the first place, where medicine is personalized, is not rushed, is focused on preventative care. And in the insurance model, it was really hard to do that because in order for people to keep their lights on, they have to see a lot more people. And then in addition, in the insurance model, the care is really fragmented and the costs aren't clear. People don't know how much they're going to be paying for different things. And so that impacts how they approach their healthcare. So with membership, it really allows me to focus on building real relationships. It allows me to catch problems early, and it helps me help people thrive instead of just reacting to their illness. So that is why I decided I wanted to practice in a membership-based model instead of the traditional insurance model. Okay, so let's see. So if you've only experienced the regular insurance model, I think the biggest difference you will notice is with the model at InTouch Primary Care, we focus on the whole person. And it's possible to do because we have the time. We have the time to truly understand what's happening. We have the time to come up with solutions that treat the root cause and not just symptoms. And just as important, we have the time to consider patients' preferences, their values when deciding on next steps. So it's not just about, this is what we're supposed to do. We also want to consider, what does the person want to do? What are their desires about their health? What are their goals? And adding easy access to that makes a huge difference. Having same next business day appointments, where having the members have the ability to call, to text, to do video visits, so that they can get their answers quickly. This means they can start making changes faster so that they can feel better faster. Okay, so I think that's where the biggest difference lies, just the fact that it's about the whole person. An example will be, I had a patient who had severe anemia. Her hemoglobin was 6.3. And when we talked, I was like, well, you're kind of borderline. You might need a transfusion. And she's like, I don't want a transfusion. Well, you might need iron infusion. Well, she didn't want that either. But she was determined to do whatever it took lifestyle-wise to bring up her hemoglobin. And because she was determined, we went through together lifestyle changes, and we used high-quality supplements. And within months, her hemoglobin levels were normal, and they're still normal now. So that was her desire, and we're able to honor that with our model. It took a lot of monitoring, making sure that she was okay and all of that, but we were able to do that within our model of care because we have the time to do it. Okay, so third question, let's see. So yes, I can share a story. Definitely, we have many stories, and during the anniversary, a lot of our patients shared their story. And I remember once a member called me over the weekend because he felt dizzy. He was already at the ER. He was about to check in. And after speaking with him, I was like, well, it just sounds like vertigo. I don't think you need to be in the emergency room. So I sent him some medications, gave him some instructions, and then I was able to see him a day or two later. And by then he was fine. And that saved him time, saved him money, And really, the bill he would have gotten from the ER alone would have covered a year of his membership at InTouch. So having that easy access really does make a difference for many people. I've also had an opposite story where I had someone come to me after she had gone to the urgent care, and there she was given steroids and given antibiotics, but she had diabetes. And she called because she started to have, noticed her blood pressure that had been previously well controlled was now higher than normal. Her blood sugar was higher than normal. And after I, had her come into the office, come to find out she actually didn't even have an ear infection. She just had wax in her ear, so she didn't need any of that stuff. And then on top of that, her chronic conditions were, worsened. And that's what happens when care is fragmented, when people go from one place to the other and they're not getting care with one consistent doctor that has time to figure out the right diagnosis and make sure that they're safely being prescribed the right medication. Okay, so fourth question. I think the biggest thing that makes me glad about the membership model is people's health actually get better. So in the traditional care system, what I noticed is it seemed like we just kept adding medications. It seemed like we were just adding, tests, and I couldn't tell for sure that people were truly getting better in the long term. But with the membership model, I've seen many patients reduce or even stop their medications because their blood pressure, diabetes, or cholesterol has improved with lifestyle support. Their labs improve, their weight stabilizes, their energy returns. So I see a true difference. And because I can follow people over years, they're not jumping from one doctor to the other, it really makes a difference. We can see what works for a person long term and continue to consistently help them feel better. All right, so last question for this week. Yes, people worry that with our model, the direct primary care model or concierge model, that it's only for wealthy people. So it's a great question because the truth of the matter is many people often actually save money with our model. I mean, if you think about how much saved with ER visits, urgent care bills, unnecessary tests and medications, just even one avoided emergency room trip can pay for an entire year of membership. And also, our members get discounts on labs, imaging, supplements, and because they're healthier, they also feel better, which helps them be more productive in general. So it's designed to be affordable so people can invest in their health now and prevent costly complications later. So those are the questions I'm answering this week. If you've been frustrated with rushed visits or unclear bills, I invite you to schedule a free 15-minute consultation with me. Let's talk about your goals. Let's talk about your concerns. Let's see if membership-based care is right for you. So the link is going to be in the description below. But imagine if you didn't dread calling the doctor's office. Imagine if your care was with one consistent doctor who actually knew your story and you felt confident about your health, you knew what your health plan is. That's what membership-based care makes possible, and I'd love to help you experience it.